DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Hi there folks, welcome to DocTalk. I'm Dr. Dan Thompson from the College of Veterinary Medicine at Kansas State University, and today we're going to talk about taking care of that neonatal calf when it hits the ground. It's bound to be a great show. My guest today is Dr. Dave Rethorst, who is the Director of Outreach for the Beef Cattle Institute at Kansas State. Stay tuned.
In a feedlot situation, we use Multimin on arrival basis. Maybe if they came in a little lighter weight, 550, 600 pounds. We use Multimin in high-stress cattle, high-risk cattle. We're looking for a better response to our vaccine. For some of the cattle that we're looking for when we use Multimin, they come in, maybe they look a little mineral deficient. They come from parts of the country that are lower in certain mineral. So we use it on those cattle, tends to make a big difference.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Dr. Dave, welcome to the show.
Glad to be here again, Dan.
Well, you did a great job. You did such a good job on the OB, and you got that 65, 70-pound calf on the ground. We thought, well, why stop now? Let's just keep right on rolling.
Absolutely right. Let's get him going off so he weans off about 600 pounds.
There you go. So Junior has hit the ground, and you know, what are some of the things right off the bat that you know that you're assessing on a baby calf?
Well, I mean, obviously the first thing we want to look at is the little booger breathing. You know, what do we need to do if it's been a hard pull, what do we need to do? Probably the oldest trick in the book is a piece of straw or a piece of broom straw and go up the nose and tickle them a little, get them to sneeze. You know, so once we get them breathing, you know, particularly if it's one where we have the cow in the chute and got the calf pulled anyway, always get some colostrum out of that cow and get it down that calf.
Right now.
Right now. Don't rely on that calf getting up in 2 or 3 hours and nursing. If you got the cow there and you just got the calf out, get some colostrum in.
Now, when you're doing that, I mean, how much are you milking out of that cow, and are you using an esophageal feeder then?
I usually use an esophageal feeder, and I like to get, you know, at least a quart to a quart and a half. You know, some of these heifers you can't get that much out of, but those that you can't get that much out of is usually pretty thick colostrum, so it's kind of high potency,
yep,
if you will, and it might only take 2/3 of a pint on some of these heifers to get what they need.
Well, and that's, you know, when I've looked at colostrum studies and things, the lower amount that an animal milks, the higher the potency of the colostrum. And so when you see some of these range cows that have that teacup udder, and you're like, geez, they aren't getting much, it's probably the most potent colostrum that we have.
They might only need a half a teacup of that colostrum.
Right, and so the calf doesn't have to consume as much because it's so much more potent.
Right.
What about okay? Now we've checked, make sure he's breathing, and we're going to milk the calf. What's something that as far as checking mom out that you're looking at?
Well, you know, obviously you want to check all 4 teats, make sure all 4 of them are open. If you're milking her out, don't just milk out of one. Make sure all 4 teats are open. Make sure you don't have any, you know, hemorrhage from a tear or something like that.
Uterine or vaginal.
Right.
Yep.
Right. You know, and you aren't going to be able to tell right away whether they've cleaned or not. Some of them will clean while they're in the chute, but not very many of them. But, you know, let's put some boluses in her and give her a little oxytocin and shrink that uterus up so we can go ahead and get that placenta out in pretty short order.
Sounds like a winner. Well, we're going to take a break.
Okay.
Oh, the other thing you always check for is twins.
Absolutely. That's why you put the uterine boluses in, so you check for twins.
After the break, we're going to talk more with Dr. Dave about taking care of these neonatal calves when they hit the ground. You're watching DocTalk, and we're sure glad that you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
You know, I think people are just kind of born with a passion.
I wouldn't be where I am today without that horse.
Oh, I'm not passionate about horses. That's just something that's in here. I can't explain it.
Some people go to a job every day. I just go do what I love to do. That's all I know is horse.
The bottom line, we're for the horse. It's whatever we can do to make life better for the horse, wherever they are, whatever they do.
It's just magic, that's all. They got me.
If we always do what's right for the horse, we will never go wrong.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
In the springtime, cattlemen need to be thinking of preventing important diseases like pink eye. Pink eye prevention includes management factors like good fly control, pasture management, along with a good vaccination program. Eyesight from AgriLabs has broad efficacy coverage as its origin from 8 different field isolates of Moraxella bovis. It is safe, smooth, highly syringeable, safe with young calves and pregnant cows, and provides superior protection against pink eye.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi folks, welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Dave Rethorst, and we're talking today about taking care of that neonatal calf. And Dr. Dave, when we departed, we had talked about, you know, mom's all right, calf's breathing, we're gonna milk that cow or heifer, get some colostrum, use the esophageal feeder and get it in the calf. Now, talk to me about the timing of colostrum, because I think that, you know, when I've looked at colostrum, there's probably nothing more important towards the health of that baby calf for maybe its life than what happens with getting colostrum in them. Why do we gotta get it in them soon?
Well, the gut on these calves has, if you will, holes in the surface of it where these large, the antibody molecules are real big, and they need these holes in the surface of the gut so the antibody can be absorbed, and those holes start closing down in a matter of just a few hours. So you want to get adequate colostrum in these calves in the first 4 hours.
Yeah, it's just, you know, we used to say you got 24, but you go over 12, there's significant gut closure.
Right, and you can tell a difference on these calves. You know, Dr. Louis Perino did a study years ago on weaning weight and carcass quality, and they could tell a difference on carcass quality on calves that didn't get adequate colostrum.
Yeah.
You know, so it affects them their whole life.
Yep. Well, let's talk a little bit about, because one of the things that, you know, when we're talking about prevention of scours and things to that nature, you know, environmentally, what kind of things are we, I know that a lot of these calves are born out on the range, but if we do bring them up and we are kind of trying to provide some sort of housing or whatever, what are some of the mistakes that can be made?
Well, you know, just calving too many cows in too tight an area, you get contamination, you know, get feces on that udder, and we'll get bacteria in that calf's gut when he nurses. Is one of the major causes of scours. You know, that's why, you know, the Sandhills calving system, they leave the pairs that have already calved in the pasture where they've been calving, and they move those pregnant cows to another pasture.
To give them a clean environment.
Give them a clean environment. Break the cycle.
So then the other thing is that, you know, warmth and keeping them dry.
Right.
And so, you know, we have about a minute here till we go to a break, but when we start to think about, I mean, very important, isn't it?
Right. Right. We want, you know, we need some place that's dry, you know, it's out of the wind. We don't need these cows laying down and calving in a mud hole. So if we can, you know, maybe even have to bed them if, you know, if there's snow or, you know, something, we might have to take some old corn stalks or old straw and put down on the ground so there's a dry place for those cows to calve at.
Bedding, taking your box blade out there. There's a million different things you can do to provide the comfort for these baby calves to keep them warm, keep those cows' udders clean, and things that'll prevent scours. When we come back, we're going to discuss more with Dr. Dave Vrethorst on keeping these calves healthy right after birth. You're watching Doc Talk, and we'll be back in a minute.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
My name's Tim Todd. Along with my wife Chris, we own and operate Green Mountain Angus Ranch out of Rygate, Montana. We give our cows a shot of multi-min pre-calving for the immune system of the unborn calf. She will transfer the minerals into the unborn calf through the blood system. When the calf is born, he has a high level of mineral in his liver, which will help with his immune system.
TrueTest Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hi folks, welcome back to Doc Talk. Dr. Dan Thompson here with my friend and colleague, Dr. Dave Vrethorst, and we are talking about hitting the ground running with these baby calves, and we've got them, we got colostrum in them, they're healthy, they're breathing, mom's okay. Now, some things we're going to do to these calves early. And the first one is vaccinations. I just want to touch on briefly. And we always recommend that y'all work with your local veterinarian. So not everything we say on here is specific for everybody's geography or everybody's cattle or whatever. Work with your veterinarian. But what are some of the things that you would do in some of the different endemic areas?
Well, typically, most producers anymore, we have them given a 7-way Clostridia or 7-way blackleg at birth. It seems to help with some of those abomasal ulcer, abomasal bloat type things. It's not a complete answer, but it will help with some of them. There's nothing more disheartening than having that biggest 6-week-old calf you got, finding him dead, all bloated up because he has an abomasal ulcer. So if we can help that a little bit with a vaccine, that's great.
Absolutely. And I get that question quite a bit. And then the other one that most people don't think about, but if you're going out there and you're tagging that calf and you're weighing that calf and you're vaccinating that calf, you know, the castration and disbudding deal.
Let's get those testicles off of them as baby calves.
Yep.
It's good from an animal welfare standpoint if we can either knife cut them as baby calves or put one of the green donuts on. If you're going to use the donuts, just make sure both testicles are below the band.
Yeah, it can't be much easier.
No.
Than if you wanted to use the little green Cheerio elastrator and band those calves off. Just slip it over the top and be done.
Absolutely. Absolutely. The only thing that causes problems is mama's snorting in your pocket. But
that
has
happened. But
ways to deal with that.
Doing it as early as possible is important. I always tell students that the longer the testicles are attached to the calf, the more attached the calf is to the testicles. So getting it done as early as possible, because it, as you've seen, has huge impact on the welfare of these animals.
Oh, absolutely. You know, if we leave those testicles on those calves till they weigh 550 pounds and we start taking them off at weaning, we stress those calves, and we all know that stress produces cortisone, and cortisone crashes the immune system, and then we have sick calves and they start dying from pneumonia because we started it all when we castrated.
And there is a premium that we're seeing being paid at the auction market if you take care of these calves. And really the term that kind of gets to me is when we don't castrate them at the right age and they're coming through, we don't call them opportunity cattle. People are calling those mismanaged cattle.
Right.
That's not something we want tagged on the names.
We don't need that.
No. Well, we got 30 seconds to break. Anything on disbudding?
Well, the easiest way to disbud a calf is turn out a polled bull.
Let's come back after the break. We'll talk about disbudding. Thanks for watching Doc Talk. We're going to take a break. When we come back, more with Dr. Dave Breathhorse on neonatal calf care.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
I'm Katie Allen with K-State Research and Extension, and got to visit with Dr. Jude Capper, who is a special guest lecturer here at Kansas State. Dr. Capper's research focuses on beef sustainability and the impact of the beef and dairy industries on the environment.
The conventional beef industry has been sustainable and will continue to be, because we know now far better how to treat our cattle, how to feed them, how to breed them, how to care for them every single day. So what that means is, over the last 30 years or so, we use 12% less water per pound of beef, we use 33% less land per pound of beef, and the carbon footprint per pound has come down by 16%, which is a huge achievement on the behalf of the industry.
This is K-State Research and Extension.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300 LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300 LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300 LA is the practical choice for your herd. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Dave Rethorst, and we're talking about taking care of baby calves when they hit the ground right after birth, and it's been a great discussion. It's always good to have you here, Dr. Dave, and for us to be able to pick your brain and your experience and knowledge of this cow-calf industry. And as we left, you know, we talked about the best way to not have horns is get a polled bull.
Absolutely.
The second one is, you know, if we do have horns, let's talk about disbudding versus, you know, when that calf's just born, because that's what the dairy industry, very few people realize that 50% of our dairy cows are born with horns. Because you don't ever see a dairy cow with horns, but they take care of them when they're little. Right,
and the dairy industry for the most part is using dehorning paste, and they're clipping those up a little bit, scraping the horn bud and putting that dehorning paste on there, and really taking their time with it. A little harder to do in the beef industry, but it can be done.
Yep.
You know,
and I've seen some of the little butane disc butters that you can have in the glove box and jump out and use that and burn that tissue. And folks, what disc budding is compared to dehorning is when you get out and you feel the horn buds and they're still moving. They're just part of the skin. They haven't attached to the skull yet. And if we can get it done then, that's the best time.
Absolutely. We aren't crunching any bone, if you will, to take those horns off. And just burning a little tissue and we're done.
Yeah.
It's done as a baby calf and it's behind them.
And I think that when we see some of the you know, there's some groups out there that have put videos up of improper disc budding or heat treatment of horns. You know, if you wait until any of that is attached to the skull, that is not the proper technique to use.
Right.
And you need to cease and desist. We're only talking about doing it if you can still feel that horn move, and it's just part of the skin tissue.
Right. You know, and some producers will, you know, wait till spring branding time and that horn bud is a little thicker, but it's still not attached, and they can still be burned effectively at that stage.
That works, but if you
don't want to go to weaning.
No, sir. No, sir. So, in a nutshell, colostrum.
That pretty well takes care of it, because we've got to have an immune calf so we can not only prevent the scours, but we can start thinking about preventing the respiratory disease that we can fight over the summer and going into winter.
Any preferences on colostral supplements or replacements out there? I mean, timing's probably more important than the product.
Timing's more important than the product. I like the Lifeline product the best because it mixes easy, and it's a serum-based thing.
Lots of good products, and get to work.
Absolutely.
Thanks for being here.
Always a pleasure.
And folks, thanks for watching Doc Talk today. Appreciate you being here, and I hope you learned a lot about taking care of those neonatal calves. I appreciate Dr. Dave Rethorst joining us today. Remember, always work with your local veterinarian, and if you'd like to know more about what Dr. Dave and I do here at Kansas State University's College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. I'm Dr. Dan Thompson. Thanks for watching Doc Talk, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. was brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection,